And so now I just briefly want to get you guys just like a brief overview using Epic. So far what we've talked about at this point is still only the first part of your day, and this Epic is going to align with the first part of your day, okay? Essentially, you did your chart review, you went and you signed out, you went and you gathered your objective data, you went and saw your patient and gathered the subjective data. And so this is kind of how you're going to be able to utilize Epic to do all of that. So, okay. So the very first thing, this is what Epic looks like. This is going to be a training Epic. So I'm not going to have any real patients or anything like that. And it's going to be a little bit limited, but I'm going to do my best to kind of give you guys just a brief overview. So you're going to log in. Really important that I want to stress right here. It should have initially also gone to one additional thing before this. So it'll pop up right before the department that you want to enter. It's going to say job, and you want to make sure that the job you select CMC resident, and then you're going to click continue, and then it's going to show you department, and you're going to click UCSF internal medicine, and this is for wards, right? UCSF internal medicine PBC. You click that, and that's the correct job and department. If you don't do these things, when you log on, it's not going to match up. You might not, when you open up notes, or the patients might not show up on your Epic. And just really quickly, you just log out, make sure that your job and department are in the right context. So let's go, and message of the day. So the first thing is you're probably wondering is how do I figure out which patients are on my team? The very first thing you want to do is just create a list, right? So all the way at the top, I hope you guys are able to see this, where it says edit list, click on it, create my list. And so I would just recommend like wards teams. I mean, this is your personal preference, that's fine. And then I'm going to show you guys the really hard way to do it, but Omar, actually, I'll show you a really easy way after that, because Omar has shared his, and you can just click copy and not go through what I'm about to show you. So pretty important information to how your sheet is going to lay out and what information is on your patient list. So the first thing you want to make sure, you want to know the patient details. I always like to know the patient name, room, bed, age, and gender. That's one thing. So once you double click it, or you can click add column, it'll come to the bottom. And then I'm going to exit. Then the next thing I want to do is the MRN. You always want to know the MRN of a patient, especially when you're calling consults. So it's good to have that on hand. Then the principal problem, which means why were they admitted to the hospital? And then you want to know the encounter duration, which means how long they've been in the hospital. And of course, you want to know the attending. And all I'm doing is double clicking, and you can see that it's auto populating down here. So we have the attending. You want to know who the resident is. Language, code, and this is the code status, and then sign off, and you want to scroll down to sign off medicine notes, and then final thing, isolation/infection, right? So then I just auto-populated these. So patient, MRN, principal problem, encounter, attending, all of these came down here, right? And then I'm going to hit accept. The easy way to do it is, I can't show you guys this here because it's a training Epic so that we don't violate any HIPAA rules. But if you click copy, I'll show you what I did right here, right? So you typed in your wards team, and this should say your name, right? This is just a training, so it doesn't say my name. And if you click copy and you type in 195574 and you click accept, it'll auto populate these here because Omar, this is Omar's, how he selected columns, and just by entering that, you'd be able to get these ones, okay? And then you just click accept and you don't have to go through what I just did. So I'd really recommend the easy way. So then I'm done, I click accept, and this is how it's gonna look. And this is why so you would ideally have patients. Let's see if we can pull up a patient list here. So right away, just by looking at, some of these might not work because it's training. Anyways, so you guys kind of saw what it would look like. So you can imagine this works. So this is the list that you're going to print out and you're going to carry with you everywhere. Right away, I can already tell the gender and the age, what their problem is, why they came to the hospital. No, see, this is weird. Sorry guys, it's I'll just show it to you guys from the list we created. Anyway, so now that you see the wards team, so eventually I'm going to have teams under this, but this is just the list that I created called wards team, right? And so right away I'll be able to tell the patient's name, why they're in the hospital, how long they've been in the hospital, what language they speak, if I need to get a translator on the phone, their code status, if I need to pull that out right away, and then if they are on any isolation. So very, very useful information in one sheet of paper. Now to add the teams to this, what you're gonna end up doing is you're gonna go to system list, and you're going to scroll down and try to find physicians treatments team. So you guys can see all the way here under available lists, and then you're going to go, this system list will be minimized. So just open it up, go all the way down to physician treatment teams, right? All the way down. Okay, and then you want to try to, so then we went to physicians treatments team, right? Not the neurology one, but that we unminimized it. And then you want to go to UCSF Med, and you'll find A, B, C, D, and you want all of these teams, and I'll tell you why. It's because you're going to be on call, and the days that you're on call, you're going to be responsible for everybody's patients when you're on call for those couple of hours while the night team gets there. And in addition, when you're on nights, you're going to be covering all those patients as well. So you're going to right click, you're going to say send to, and then you're going to send it to the list you just created, which is wards team. And you're going to do this for A, B, C, and D, all of these. Right click, so click on it, right click, send to, wards team. So now I can minimize it or I can open it up. And then I have all the wards team. You can also make another list, but just for the purposes of you guys being familiar with what other list you may need is the ICU teams. So for the ICU, you'll find it under ICU blue, ICU gold, ICU purple, but this is all about wards. So specifically CRMC. So all of the wards teams will be found under this. So now that you've added them, let's talk about how you can print out just this basic sheet that will have all the patients listed in a row. Very, very simple. All the way at the top right here, you see where it says print. Right here, I can't do it because there's no patients, but let me see if this will work here now. So if I click on just any, so ideally you would want to click on your specific team under wards team, click on your specific team, open it up. But for this purpose, we'll just open up Chrissy's list, and then all the way at the top right, you click print, you click current list, and then you print it. And you can adjust based on the style that you want to know. And this will print you out the first sheet, okay? So we clicked on the list, we went all the way to the top here, and we printed this. Now, sign out will be another thing that you will want to print. How you can find that is, again, you click the specific team. And And for you to be able to edit sign out, you want to click on each patient. Sometimes this bottom part here could be minimized and it might look like this and you might be confused, but if you press this up arrow down here, it'll open it up. And then what you do for sign out, to edit sign out, is you find where it says sign off right here. And you see where it says medicine sign off notes. To edit it, you're going to click comment, and then you're going to write anything, right? Like 67 years old, yada, yada, yada. And then you're going to click accept. And this is going to be your sign out. But you have to individually go through each of these, click sign off, and then click comment, and just make sure that this is not minimized, right? So if it looks like this on yours, just push the arrow up. Then now you've updated all your sign outs, right? Every day the sign out's gonna change, right? You've updated it, you wanna print it. You're gonna have to print it every day for the team that's on call, that they pass on to the night team. But in addition to that, some people choose to use this for their presentation, because if you do a really good sign out, then it has what you would want to present on. And how you can print that out is you click print report, and then you click uncheck that and click medicine sign out. Okay, so how did I do that? Print report right here. And then you uncheck that and click medicine sign out and you print. So this is where you get the list of patients printed, as long as you're on the right team, remember. And then this is where you get the sign out. And then in order to edit the sign out, then you have to go through sign out and comment, and you go through each of your patients individually to do this, okay? So now we can get into kind of just chart checking. Let me just open up a random one. Okay, so you're gonna find your groove, and you're gonna find which order you like to chart review in the morning. But what I will recommend you do, and you can edit it right here. Do you see this hammer right here, or this tool? I don't know what you would call it. I don't know why I said hammer. I would recommend that you can change these in the order that you use them. So for me personally, I start with summary. Then I have the chart review, and then I like to have the intake and output. And then after that, I go to results. And then I like to have orders. And I'm just like dragging them, right? Like switching them up. So results, orders, and then I like to have notes. And then I like to have admissions, rounding, and discharges. So to make my life easier, I'm just going to bring this all the way to the back here. So the other ones, you can do whatever order. I would say my major ones are all of these. So summary, chart review, intake and output, results review, orders, notes, admission, rounding, and discharge. And the reason why I do it is because this is literally how your chart checking will go. You'll go from one to the next, to the next, to the next. Makes it very easy to have that routine that we talked about, and makes it very easy for you not to miss anything, because you're going to go from one to the other one to the other one. And so once you have that set, you just click accept, and let's go. So now that you see they've rearranged my order up here, and that's really nice. And then the second thing that you're going to want to change is the layout for this one. I would say what you really, really want for this one, add or remove. Okay, so again, with this tool right here, except now we're paying attention to this. And you move it by clicking on it, and then you can move it up or down with these arrows right here. I would say one of the most important ones is adult overview. I always have this right on the top. And then the second one for me is ventilation, accordion. And I'll explain through all of this. I'm just showing you which order and how to do it. And then after that, I would like to do intake and output. Yep. And then lastly, Mars. All right. So do you guys see how I did that? I don't want this one, so I'm going to move it down. So we have adult overview, ventilation, intake and output, and then MAR. And those are really the 4 that I focus on. There's all of these. You can mess around and see which ones you guys like. Glucose trending is a really nice way to trend your glucose if you like this one. But these are the ones that I routinely use. So then you click accept and it rearranges them. So again, you do that by using these little tools right here. And so this is how I start. So I open up my summary, my first slide, and then I click adult overview. You're going to see all the vitals. And typically what I like to do is arrange it by 4 hours. And you should always be writing down and reporting your vitals in a range, in a 24-hour range, right? So you want to say the heart rate went from 60 to 79 and the blood pressure is 136 to 156, whatever it is, you always want to give a range, right? And if, for example, there's only one time reading of 176, you can narrow your blood pressure and be more specific and say, you know, the blood pressure usually tends to stay between 130 and 140, except there was this one episode where the blood pressure went up to 170, right? Instead of saying 130 to 170, you're kind of narrowing that range and just saying that that value happened once. So use your best judgment, but always report it in a value. So you always want to write down the maximum temperature, the heart rate range over 24 hours, the respiratory rate, their oxygen saturation, how much oxygen they're requiring, and how is this different from what they started with, and then the blood pressure range, which we talked about. So this is really nice. It has everything. You can arrange it by however many hours you like. Then you go to ventilation. This is more important for the ICU, but if anyone's intubated, you'll have all their vent settings here, how much oxygen they're on, and it makes it really easy to track that. And then intake and output, especially flow sheets. When I click on that, I really like this because it just kind of tells you anything about intake and output and where it's coming from and what it looks like and what the drips and what they're on and how much they're eating. So I really, really like this for that. And then let's see. Okay, so we can go back to summary. And then the final thing that I'll just briefly talk about is just the MAR, what we call the MAR. And this is what I meant by making sure that your patients get the medication that they are to be given. And if it's green and you click on it, it'll tell you what time and how much was administered. And sometimes it'll be red and sometimes it'll look like this, which means it's not given. And you should always figure out why a patient didn't get a medication. Most of the time, it could be because they refused, and then you have to talk to them about it and address it. You don't want a couple days to go by and notice that someone's been refusing their bowel regimen or a medication that they need, right? So that was summary. So I just got my vitals. If they're in the ICU, I looked at their vent settings. I looked at all their intake and output. I looked at their medications. Then I go to chart review. And I really like using chart review for this reason, because here it'll have all the notes from all the nursing, all the physicians, all your consult notes, and I go through every single note up until the last note that I had read the previous day. You can view labs this way, or you can click results review this way, and it'll have a breakdown of all your labs. And I just go through one by one and write them down. This is where you're going to find, so it'll have separate categories like laboratory data, it'll have microbiology where your culture results will be, it'll have imaging, it'll have everything here. And then another place for you to find imaging is under here. You can click it and open this up. So I really like that because I've reviewed all the notes, I've looked at the labs, I've looked at the imaging. those are just the ones that I want to briefly point out right now. Again, you can pull up the same intake and output form right here if you didn't do it over here, if you didn't do it on this one. Otherwise, another way to look at the results is just to click the results review. So instead of going to chart review and labs and imaging, you can just open up results review and it'll show you everything. And then finally, you come to orders. So these are already ordered. So these are the active orders for that day. One thing that I really want to make sure that you guys know is that some orders expire and will fall off and you won't know. Or you'll see that the lab, there's an end date that ended like yesterday. So you always just want to look at like when it's going to be due and when it expires. So this one, for example, says for 14 days, right? Sometimes they'll give an end date until specified means it's not going to fall off. So just always know what you're ordering. And they are grouped very logically. So you start with what the admission orders were, what the full status is, or code status is, their diet, their labs, the meds they're on, the active medication they're on right now, any nursing communication, and then surgical or path. So I'm going to quickly just walk you guys through admissions, just not too much in depth, but just really quickly, because I know we're going to start going over time here. So for admission orders, still in the same orders, you click on order sets right here. You click adult admission shell and you open the set. And so you just go through this admission set, right? And we already talked about this, so I feel comfortable going a little bit quicker with you guys. So we're gonna update the treatment team. When it means a red and has this marker right here, means that it's not gonna let you sign it because it's not complete. So writing our attending's name. So usually this should say, this will be a little bit different and it'll be admit to, but this is just a training one, so we'll just forget about that. If you don't fill out the code status, we won't do it for now, but it's gonna ask you right away, full code, do not resuscitate, full treatment, do not resuscitate, do not intubate, comfort measures only. So let's just not fill this out and see what happens. Do you want them on tele? It's going to give you an exclamation point because you always want to tell them why, right? So let's just pretend. So I filled it out, the red went away. How often you want their vital signs. And then if they're heart failure, you want to do, or any kidney, AKI, or for some reason you want to be really strict about their intake and output and really monitor that. This is what I was talking about when I said activity level. You can do bed rest and advance as tolerated, or you could do progress mobility as tolerated. Consider if they're a fall risk, if they're an aspiration risk, if they are a seizure risk.